brief answer, that would be really helpful. So to each of you, and we'll kind of go through in the same order again, beginning with you, Dr. Benz. What is the one thing elected officials can do to positively impact children's health in the face of climate change?
What can elected officials do? I think listen to the experts. There's been this huge trend in our society to forget the experts and go with what we feel. But there are people, I mean, you can go to the CAPE report, there are thousands of climate scientists that do the economics, the technological pieces that, you know, there are wonderful examples of how we can stimulate our economy to transition to a green economy. I mean, it's vote, do something, and don't vote on party lines. Vote for all of us. This should be a nonpartisan issue. This is what we should be moving together, and people get very threatened because it's your livelihood. It's an immediate threat. So we have to scoop everybody up and include everyone as we transition, and that's what politicians. So what we can all do, I think, go email your MP, talk to your MP, talk to your MPP. There are far more people going to, from the carbon lobby, going to talk to your MPPs than we are. So let them know that you're there. And speaking to policy members, I've had people who write policy say, you know, honestly, like, I think this is important, but at the end of the day, we have to write policy that people will vote for. And so let them know that you're out there, make some noise so people can write the policy that makes change. And that's not what I'm an expert in at all, but I know there are experts.
Dr. Bell, do you want to comment? We'll do 30 seconds if we can for each of our panelists. Dr. Bell, do you want to comment? You're on mute.
All right. Use science, not ideology. It's kind of a summary of what Anna was saying, but it is so critically important. Evidence for Democracy is a really good organization for that. I'll put the link up to them.
Thank you. Andrea?
So if we're talking about what politicians can do to make a difference for climate change and our kids' health, then I think what I would like to recommend is there's a book that was written last year by a Canadian economist you may have heard of before, Mark Jacquard, Citizen's Guide to Climate Success. He's got a lot of ideas in here about really simple, concrete policies that can be implemented without a huge amount of pushback, ideally. So if you're looking for concrete things to suggest to politicians, like specific policies, it's a great place to start.
Can you please put that in the chat too for us?
Sure.
Echo, did you want to share a thought with us here?
Sure. So I would say that I agree with a lot of previous panelists in that we have to let them know that we're here and that we do care about this. But also newer and newer perspectives are going to have to be brought to the table, and that's sort of what I was talking about earlier as well. I think that if the only people advocating for this are a specific group, then politicians are more likely to think of it as something the minority wants instead of something that would be better for everyone. So I would say that probably just get a lot more people involved and a lot of different kinds of people.
Thank you. Thank you so much, Echo. That's perfect. And last but not least, Dr. Bierstone, what did you want to share?
Just to add to that, I think there's a bit of a move in some circles to try to move our measure of, I guess, our country's success from the concepts of GDP to more encompassing concepts that encompass health and well-being. And I think that's a huge sticking point in how not only climate policy is dealt with on a governmental level, but how many other things affecting health are evaluated, like basic income and paid sick days and all those other things that impact the social determinants of health. Another idea that has gained some traction is this idea called health in all policies. What health in all policies mean is that, you know, there's this the way things are done in government now is that health and healthcare are managed in a silo, and then you have social services, and then you have the environment. But all those things are so integrated, so you can't. So just to remember that healthcare only accounts for 20% of health outcomes. The rest is the social determinants of health: housing, nutrition, a secure income, protection from racism, all those things. And we need to have this much more, or governments need to move to this much more integrative approach where all policies are evaluated based on their impacts on health and well-being. And I think that's a huge sticking point right now.
Thank you so much.